But why should we do this? Apart from the third level of happiness, there are some other benefits of unselfishly giving of yourself. When I was in college, I heard a physician give a message entitled, "The Doctor Must Die," from which I borrowed to get "The Dentist Must Die." I must say that this message has had a profound impact on my life. In his message, Dr. David Thompson gave 7 reasons why the doctor must die. I can only come up with 5, and it's probably just as well since you didn't want to hear 7 anyway, and I'm out of time. But the first reason we must die is so we can be likable. The dentist that refuses to die can become quite unlikable. We are entering a prestigious profession. However, we cannot let this get into our heads. Dr. Stewart once told us that MD does not stand for minor deity. But if we're not careful, we can perceive ourselves as dental minor deities, and we can become the kind of people no one wants to be around. All of us have met people like this, and we don't want to become them. During his graduation speech at my alma mater in 2003, the author Ravi Zacharias warned that year's graduating class. He said, if we don't keep ourselves humble, God has rather creative ways of making us humble. And we don't want to experience this. It is better for us to be humble on our own terms because we choose to be, rather than having to be. The second reason is so we can be teachable. This goes hand in hand with what was just mentioned about humility. The dentist that refuses to die will not be teachable, especially from those who have a lower level of education. But we have been well trained here at the SDM. Believe it or not, we do not come out of school knowing everything about dentistry. Many of us will be surrounded by assistants and hygienists and lab technicians who have been working in dentistry longer than some of us have been alive. They will have some things to teach us, but only if we are humble enough to listen. The third reason we must die is so we can be trusted. The dentist who charges the patient for every possible procedure, oral cancer screen, whatever else, will have a hard time being trusted. So will the dentist who is always trying to sell the patient something they don't need. In order to be trusted, we must be people of the truth. Andrei Sakharov was the man who gave the Soviets the nuclear bomb. Before he died, he made the following statement. I've always thought that the most powerful weapon in the world was the nuclear bomb, but I've come to the conclusion that the most powerful weapon in the world is not the nuclear bomb. The most powerful weapon in the world is the truth. And the truth is your most powerful weapon as a practitioner. The American College of Dentists calls veracity the bedrock of a trusting doctor-patient relationship. Veracity means telling the truth, even when it's not what the patient wants to hear, or even when it damages your own reputation. It means telling the patient when you mechanically expose their pulp, although I know that never happens at school, or when you perforate a root. Telling the truth may damage your reputation in the short run, but it will help your reputation in the long run. The truth is oftentimes painful, but it's not nearly as painful as the consequences of not telling the truth. The fourth reason we must die is so we can deliver quality dentistry. It was Rick Lepo who once said, it's all about quantity, not quality. Given the context, I would agree with him. He was describing his criteria for choosing restaurants, and I myself use the same criteria. However, if we apply this mentality to dentistry, it will get us into trouble. Some of you are already laughing when you're listening to me talk about quality and quantity. I haven't figured out how to do either one, especially the quantity part. There's nothing quantity about anything I've done during dental school, and the faculty up here will testify to this. Dr. Don always accused me of working the 5 to 6 shift in the clinic. One time I started an occlusal equilibration with a slow-speed handpiece, and Dr. Langwalter asked me what century I wanted to graduate. So anyway, take this all with a grain of salt coming from me. This does not mean that delivering both at the same time is impossible, nor does this mean that more time spent equals more quality. However, all this being said, there will be times in busy practices where the clock is ticking and patients are waiting, and we will be forced to choose between the two. I hope that we will choose quality over quantity. Choosing the opposite will cost us in the long run. Dr. Langenwalter warned us about having to redo work that we have already done. He said it not only costs you doing the work the first and then second times, it costs you the lost revenue that could have been made while you were redoing that original work. Rather than the words of Rick Lepo, we would do well to live by the words of Grandpa Peter Dawson. He has his own adaptation of the Golden Rule that he calls Widium, would I do it on myself? Is a good question for us to ask ourselves. The final reason we must die is so we can be number one. In an article published in the September 2006 edition of the ADA News, Missouri dentist Donald Fuchs responded to a then recent Gallup poll listing dentistry as the 5th most respected profession. He said, why, however, aren't we number one in the eyes of the public? Could it be that over the last 2 decades, dentists have drifted from being patient advocates to current wildly popular practice advocates? Just take a look at the continuing education courses being offered today. I don't think that I'm making a risky wager by speculating that the majority pertain to practice management techniques that increase office revenues rather than improving patient care. Peter Schutz was once the CEO of the Porsche Corporation. In his book, The Driving Force, he defines three of the reasons why businesses exist. Number one is to provide goods and services for the common good. Number two is to provide a satisfying life for its employees. Number three is to provide a satisfactory return for shareholders who have invested their money. However, if reason number three is pursued at the expense of numbers 1 and 2, patients and employees oftentimes end up getting treated like cattle rather than human beings. And then we get what we deserve in the Gallup poll standings. If we're going to be number one, then we're going to have to give of ourselves above and beyond that which is expected. We're going to have to practice dentistry the way Dr. David Stevens was practicing medicine at that emergency room in Kentucky. When we do this, we will achieve the third level of happiness, as well as the other byproducts that come along with unselfishly giving of ourselves. I will close with the words of Jesus as recorded in the New Testament. I am among you as one who serves. Whoever wants to be first must be slave of all. The greatest among you will be your servant. Thank you.